SOADI Southern Ontario Aboriginal Diabetes Initiative. Its mission is to eradicate the devastating effects of diabetes so Aboriginal people will once again enjoy the good life and the health of our ancestors. Our vision is to support Aboriginal communities to working to decrease the high incidences of diabetes, its complications through prevention, intervention, and management activities. Some of our values are autonomy and diversity, community-based responsive services, holistic wellness, again, that's physical, mental, spiritual, and emotional, a spiritual sharing and cooperation, personal choice, and the right to privacy. So this is what our current regional map looks like. And SOADI Footcare works with every single one of those regions and its diabetes prevention coordinators. And in future, we're hoping to move past Southern Ontario to all of Ontario. Our purpose is to provide foot care services to Aboriginal people that are affected or at risk of diabetes and its complications. We strive to empower communities through education, self-care resources, professional assessment, and referrals. And diabetes is a significant concern within the Aboriginal communities for a variety of reasons other than the high rates of disease, including earlier onset, greater severity of at diagnosis, as well as high rates of complications, lack of accessible services, extremely so in the north, increasing trends and increased prevalence of risk factors for populations that are already at risk. So even though they are at risk through their genetics, they're also at a greater risk due to the risk factors that are in their area. Up to 5% of all diabetics currently have a foot concern. Foot complications is the #1 cause for hospital admissions in diabetics. Almost half, 43% of all diabetics have their first hospital admission associated with a foot ulceration or infection. Most amputations begin with an ulceration, and that's 85% or more. 1 in 6 diabetics will develop an ulceration in their lifetime. Mortality rate is higher post-amputation or ulceration. Why? It's sensation loss. That protective sensation, that ability to feel, the biofeedback from the foot, the feet to the brain, as well as circulation loss. That thickness of the blood from the high level of sugars makes it very difficult to heal that wound. So those two things are the most important thing that you look at when you're looking at the risk factors for diabetics with foot care. There's 4 different components to our program. We have our foot care events, and that's where we do our annual assessments. We go into the community upon request, and we provide foot care services. We provide education, we do presentations, we provide workshops, we do activities. We've developed resources such as Foot Care Bingo and Foot Care Jeopardy to run with the community to engage them on a social level so that they're learning while doing activities. We also provide screening. We work with foot care specialists, chiropodists, registered foot care nurses that are able to provide assessments, treatment, and referrals for the community. So then that's when we go to the next level of our sustainable foot care locations. So at that time when we're in there with the events, we try to gauge the community to see what are your needs and what services do you already have. That's where we work with community members, organizations, and we set up an ongoing clinic right there in their community. Provide care for them on a 6 to 8 week basis. So those clients feel comfortable coming to that center. But in certain cases, when we don't have an opportunity, where we don't have an area or a space or an organization to work with, that's when we rely on our individual subsidies. So we're not going to leave them without. We're going to book them an appointment with a clinic so they can go in and get treatment. Also with our subsidies, we may be covering orthotics through those as well. For those high-risk clients that are pre-ulcerous, we cover orthotics for them. Self-care and prevention resources, again, those are the tools. So in our foot care events, we not only do our education, screening, treatment, and referral for follow-up care, but then we give everyone who comes through that clinic, we give them a foot care resource bag. First and foremost, you want to use a bar of soap. You're going to clean your feet first. While you're cleaning your feet, you want to take a little scrubby brush. Gently scrub away any dead skin around and under your nails. After you rinse, use a foot file to get rid of any of those callousy areas. One direction, up to 30 seconds. You don't want to cause any too much friction or heat there, right? And then rinse your feet, pat them dry in between the toes, Remember, in between the toes is a breeding ground for fungus. Then you apply the moisturizer. This is a biodetic moisturizer. It is in a capsule, so if you are going to be dipping in again, try using different fingers so that you have that infection control. So then after that, that's when you use your handy dandy mirror and you check to see if there's any concerns down there. And then you want to use, we worked on this and we designed this for community to use, and it's your guide for a healthy foot care checklist. Feel free to photocopy it. If you lose it or run out, SOADI Footcare has a copy on their website. Use a dry erase marker on this. You're going to go through the day of the week. You can even mark down what day of the week it is. Follow the checklist down. And if there's any changes, you have a spot right there to put down your next appointment. So it helps you and guides you through to stay on track with your foot care. So in between, while you've booked your appointment and you're waiting for your care, we've equipped you with your own first aid kit. We also give you a 25-minute DVD, and it teaches you about what a chiropodist is, what a foot care nurse is, what it takes to do your daily foot care, what all your resources are involved, and what other tactics there are to live healthy. Last but not least, we have our grandfather stone to remind you of all those teachings that we provide to you that day. We go through our 7 grandfather teachings. We look at wisdom. First and foremost, we need to learn why it's important to take care of our feet. So then we move to the next one, love. Our feet need TLC just like every other part of us do. Respecting them. Don't try and fit them into shoes that they don't fit into. It's only going to end in bad news. Bravery. Having that bravery to see somebody if you know that there's a concern. Honesty. Being honest with yourself when you do have a concern. Being honest with yourself when you know that your feet are hurting you. Or if you're knowing that you're living with diabetes, to be honest with yourself that it does affect your feet and that there may be a problem going on down there, and to be honest about that. And that humility. The humility takes a lot, especially with women too, right? We want to have those pretty shoes. We want to be able to wear those high heels, right? But you got to be humble in the fact that sometimes it's not the best for us. You know, and sometimes we need to wear those wider shoes that don't maybe look as nice, you know, or shorter heels that may not prop us up as much. And the truth, the diabetes does affect your feet, and if you don't take care of your feet, you will end up with an amputation. Most cases, you will end up with an amputation. 85% or more have an ulcer within their lifetime or an amputation. That is a truth. It doesn't have to be your truth. You make what your truth is. If your truth is that you're going to take care of your feet, then that's your truth. And that you're not going to end up with an amputation because you're going to take a look at your feet. You're going to deal with that snowball if it comes rather than run from an avalanche. What our holistic foot care events look like. So when you come in, you're given a little registration and consent form for treatment. And while you're waiting to be seen, that's our teaching opportunity. Call me up. I'll work with you on this. I'll help you. And you can use those teaching opportunities. You get them registered. You get them situated for what they're going to be receiving for their treatment. You sit with them, you educate them, you talk to them a little bit about foot care, talk to them a little bit about healthy practices, you know, and engage with them as to what their needs are. And this quote pretty much sums up our foot care program. That we have all the tools that we need to have that good life and stay in balance and harmony. And it's up to us as people to look after ourselves in a good way. And it's our responsibility to take back that good life and make it our own. In our foot care program, it's not just about looking at our feet. It's looking about the whole picture. We want to look at everything that makes us, not just the mental, spiritual, emotional, but everything, the physical too. The physical part of looking at our feet. Now, some of the things that you may go through when you're first diagnosed with diabetes, the mental part, we go through that shock. We go through that denial. You need to get back to that spiritual spot, you know, and see maybe a spiritual advisor, an elder, because if we're not well spiritually, it affects the rest of our areas. So chiropodists, a lot of their primary care includes foot deformities, foot infections. They diagnose foot concerns that are going on. They specialize in foot care and the study and diagnosis of medical and surgical treatments of disorders of the foot, ankle, and lower extremity. They work with a lot of these tools, nail cutters, callus shavers. Only the experts need to be working with these. Nobody else. You thinking that you can dig your own ingrown toenail out? Well, you probably won't. If you're working on your own feet and you have neuropathy, how do you know if you're going too far? You can just keep going. You won't feel it. Now, foot care nurses are just registered nurses that have taken advanced foot care. They are also able to assess the general health of the feet. They're able to assess the circulation, assess the sensation. Can you feel? They're able to take a look at your nails and do nail care, skin care. Recognize any abnormalities, right? They're not able to diagnose, but they're able to recognize any abnormalities. And that's when they can refer you on to the specialist. And reflexologists. There's certain pressure points that you can have and that you can push on. Stimulating the pancreas, the organ that produces the insulin. That's amazing. We want to stimulate that. Stimulating circulation. Again, amazing. We want that. Stimulating the sensation, that biofeedback. You're stimulating the nerves. Again, amazing. We want that. So this is a preventative measure that's crucial to your health of the foot. So this is just a little graph to show you how diabetes and uncontrolled diabetes can go to amputation. I always like to use this little teaching tool. And we're eating our foods throughout our day, right? And as they come through, they attach themselves to our red blood cells, and our red bloods are floating through. A nice healthy cell is open. You're drinking plenty of water. You're physically active. You're getting the blood flowing. You're eating good foods. You're avoiding the toxins. You're open for business, right? And my hand is the insulin. And this is the glucose, the food that you eat, the vegetables, the fruits, the sometimes breads, right? Sometimes. And you're eating those. And it comes along to a nice healthy cell. And there's only a little bit of glucose because, again, you're eating only sometimes glutens and those sugary foods. And you're eating mostly fruits and vegetables, you know? And it can handle it. And it unlocks the door and it allows that glucose to be fed into the cell, right? But what happens when you don't drink a lot of water, you don't eat a lot of good foods, and you're actually replacing it with a lot of sugary foods, carbohydrates, those glutens, those fatty foods, and you're not exercising, and you fill your body with a lot of toxins? It becomes closed off and resistant, right? And it's resistant to being fed the glucose. The cell ends up dying off, and the glucose, it stays on our red blood cell to travel throughout our body. And it gets to the smaller parts of our bodies, such as our fingertips, our eyes, and our toes. Those areas are so small. They're so tiny that only one red blood cell can get in at a time. And on either side are our nerve endings, right? And there are feelers, and they're encased with a protective coating. And when those red blood cells go through, those sharp edges of the glucose are cutting and damaging our nerves with every pump of our heart. It's like glass, cutting those nerve endings, damaging those nerves to a point where over a period of time of high blood sugar levels, they die off and they can't feel anymore. So you increase your risk of injury because you can't feel. You have that cut or that sore. It's open. It's an open area. It takes longer for our body to heal. That increases our risk for infection. Prolonged infection period. They're having a party down there. They're inviting all their friends. They're saying, hey man, they're on a coffee break. Those Spartans, they're on a coffee break. Bring in your friends. Let's get more. Let's have an infection party. Bring in the gangrene. He's a load of fun. With that high blood sugar level, it comes and it goes out of control. And that's where it goes from a snowball to an avalanche. Because that little cut on the bottom of your foot can go to an ulcer in a very short amount of time, a month to 3 months. Getting away from this neuropathy, that loss of sensation, and that amputation, how do we prevent that? First, controlling the blood sugar levels, and that's where I was saying is small pieces, small chunks. Loving your feet every day. When is the best time to do your shoe shopping? Late afternoon. Your feet naturally swell throughout the day. But the regular daily exercise, you want to get out and take a walk, take some fresh air in, and just keep moving. You don't need to be an Olympian. Some good characteristics of footwear: strong heel support, thick rubber soles, a nice big toe box. You want a nice big toe box for your toes to wiggle. Those are 4 areas that you want to take back to your community members. This is an activity that you can take back to your community. It's cheap, it's fast, and it's effective. All you need is a blank piece of paper, a pen, and your footwear and your feet. We're going to place bare feet on the paper, trace your foot around, and then after that, place your shoe on top. And if any of those lines are outside your shoes, then that will tell you that your footwear is too small. And you always remember this little teaching that I like to say, is your feet walk upon the earth, and through that, your spirit is connected to the universe. So you walk with care and protect your feet so that you can continue walking throughout your days and that they carry you through and you walk in a good way.